So guess what? It's not how many steps you take, it's how long you walk. So there's a new study that suggests longer walks are better for heart health than logging in several shorter strolls throughout the day. Dr. Marc Siegel, Fox News senior medical analyst and author of the new book, The Miracles Among Us, How God's Grace Plays a Role in Healing, which is out November 18th. So I don't know why these studies keep going back and forth. Walking overall is good, but this now says this, that people who walked in bouts shorter than 5 minutes 5.13's risk of death during the study period and a 15.39 risk of developing heart disease during the same study period. But people who walked in bouts exceeding 15 minutes, you can just see the numbers there. It's a pretty stark difference. You really cut your risk if you walk longer. How long are we talking?
At least 15 minutes, but we're talking about a total of over 5,000 steps a day, which is 2.5 miles. And most people don't do that. Most people are way too sedentary. And I'll tell you why this is the case, even though it's an observational study. I'm going to tell you facts here, which is that you start off with a lot of stress hormones building up in your body. When you're sitting around, now granted, Hemmer's stress level is much lower being here with you because you calm people.
He's so chill now.
He's chill. But most people have stress hormones building up. And when you get out there and walk, you're replacing those stress hormones with dilated blood vessels, lower blood pressure, you're breathing air more slowly, you're communing with nature, the spiritual reality, like I write in my book, extremely important. But if you do it for 5 minutes, you go right back to the stress again. And then you're having coffee and you're eating potato chips. So the longer period allows the body to recalibrate and the metabolism to improve.
That's a really good point. Yeah, it has to be sustained.
No question about it. No question about it.
Another topic here, a study finds that men need more exercise than women to fend off heart disease. Women,
finally.
Yeah, women, 4 hours of moderate exercise every week lowers the risk of coronary heart disease by 30%. Men, 8 hours of moderate exercise every week to lower it by the same amount. Why is that?
I can tell you, having been married for almost 30 years, that women are better than men. There's no question about it. Physiologically, again, spiritually, women are superior. But here's the reason why. We have testosterone, which is bad for cholesterol. We tend to build up fat in the wrong places in our guts, which causes inflammation. We smoke more, we drink more, we don't exercise as much. All of that puts us at risk for heart disease, and almost twice women. Women start to catch up after menopause, but it takes a long time for them to catch up. With all these risks, we need the exercise way more than women do to make up for it, and that's why it's twice as much.
In your new book, how much do you talk about exercise? And sometimes it might feel like a miracle if you can find 15 minutes to walk.
I think exercise is huge, and it's for the exact reason I just said. Bob Montgomery, our chief of surgery in my new book, recovered from multiple, I think over 30 cardiac arrests before he had a heart transplant. But you know what he was doing? He was in Patagonia, climbing up in the mountains, extreme nature, communing with nature. Now, not everybody out there can be going up Mount Everest, but if you do that kind of extreme exercise, and we've seen that from the mountain bike rides on President Bush's ranch, you commune with nature, you commune with spirit, you commune with God. And Montgomery says to me, he's had multiple out-of-body experiences this way, both when he's been in comas, but also just when he's been on the top of mountains, where God visits him, where prayer is directly answered.
30 cardiac arrests? Is that what you said?
That's right. And then he had a defibrillator put in, and he figured out he could operate with that defibrillator, and eventually he had a heart transplant. But he was in a coma. Listen to this. He was in a coma in Patagonia, and everybody else in the intensive care unit didn't make it. He made it. He dreamt he was performing surgery in the 1800s with ether, and when he woke up, he found that every single detail was accurate. He was visited by God, out-of-body experience.
Great book. Well done. Miracles of Medicine. Thank you, Doc.
Great to see you. Great to see you guys.
Soon.
Hey, everyone. I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.